So the next thing I wanted to talk about is some common aesthetic adjuncts that we do with orthognathic surgery. So probably the most common is genioplasty. We tend to move the upper and lower jaw, and this really helps with the balance, the airway, the TMJ, and aesthetics. But frequently the chin also needs to be moved separately. There can be asymmetry, and doing an osseous genioplasty can reposition this in space in the most three-dimensional and comprehensive way possible. Different from when we do chin implants. The other advantage compared to a chin implant is that this is moving some of the muscle and the musculature that supports your tongue that can help open up the airway. So genioplasty is one of the more common things that we do that's typically aesthetic and done with orthognathic surgery. The other thing we very frequently do is fat grafting. So this is something we use in plastic surgery all the time, where we harvest fat or adipocytes, usually from an abdomen or leg donor site, small amount, and it's a very easy harvest and recovery. There's no kind of additional pain or discomfort really associated with this beyond just a very mild amount. We take this fat, we're able to strain it and really concentrate it. So it has adipose-derived stem cells, it has a lot of your own tissue, and we use this to augment certain areas and make sure that the balance is as smooth and as ideal as we like. Additionally, and we've written several studies about this, using fat grafting and the adipose-derived cells helps with bruising and swelling. It seems maybe counterintuitive that injecting an additional substance would do this, but it seems that using your own tissue and cells helps mitigate some of that inflammatory process and helps with the bruising and swelling. Other things that we do concurrent with jaw surgery may include submental liposuction, or suctioning some of the fat underneath the jawline or the neck to help really crispen that up and give a nice jawline, prevent a double chin, those sorts of things. We may use platelet-rich plasma injections, which comes from your own blood and has excellent growth factors, and this is good for dark circles under the eyes. It's good to recondition the skin. When we do it in concert with fat grafting, it helps more of the fat stay, less of it become resorbed. Additional things we may do include facial bone implants. So there's different materials, and I'll talk about this in another video in more detail, but at times when removing the jaws, it may uncover deficiencies in other parts of the face or facial skeleton. So this may include the cheeks or cheekbones, the under eye region, sometimes the jaw angle, sometimes the area near the nose, and we can use facial bone implants of various materials to help augment those areas. The converse of that, sometimes the jaw is too squared off or wide or has too much bone, and we may want to contour aspects of the cheek or the jaw angle. Sometimes we do this with V-line surgery and other ways to improve symmetry, so that's facial bone contouring. And that's commonly done at the same time of jaw surgery. Sometimes we can do those things separately or in a staged fashion as well. And the last thing that we've been doing more and more concurrently may include what's called an upper lip lift or a corner upper lip lift. And this is important because with aging, the upper lip gets quite long, and when we're repositioning the jaw and the upper front teeth, we want to set the appropriate smile. So a lot of that has to do with how we reposition the Le Fort segment or the maxilla and those teeth, but in some situations, especially in a patient that's undergoing this and has facial aging, we may also wish to shorten that distance of the upper lip. And we can do that at the same time as jaw surgery or staged. The most frequent thing I do in a staged fashion is a rhinoplasty. And this is because when we're moving the jaws, it can change the appearance of the nose, sometimes for the better, sometimes for the worse, sometimes a little more neutral, but typically with jaw surgery, we're opening up some of the nasal breathing, but we may want to improve that even further with some septoplasty, things to open up the valves of the nose, things to shrink away the turbinates inside the nose, and then lastly, slightly more aesthetic, is reshaping the nose with the tip in balance and putting this in balance with the rest of the face. Typically, we'll do that as soon as a couple months after jaw surgery, but it can be done more commonly 3, 4, 6 months after jaw surgery, and it's a very nice adjunct both functionally and in terms of aesthetics. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.